Thanks, Allison. It's a big one. Oh, let me send it to everyone. It's what accomplishment are you most proud of at your organization? It's a big question. You might have to think about it a little bit. But I love it, especially to kick off. We're still in new year mode here, so it's good to reflect on the last previous years, and what accomplishments are you most proud of at your organization. And if you're new to the national call, welcome. You want to introduce yourself in the chat, just your name and your organization. We're happy that you're joining us. Hopefully you can be here as many Mondays as possible. Thanks, Kathy. Do you want to share that? We'll hear from you if you want to unmute and talk a little bit about it.
Sure. Thanks very much, Claire. Yeah, so Humane Canada, as the national organization in Canada, works very closely with other organizations in advocating at the federal level for changes that will be beneficial to animals across the country. So we saw changes to our Environmental Protection Act and the requirement for toxicity testing on animals last year. Our Humane Canada's Indicators Project got lots of great reviews from various people in the federal government. And most recently, just last week, we had notification from one of our federal MPs that they were going to be making amendments to proposed legislation that would see abuse to animals included as a part of coercive control. I'm sure many of you know what that is in our federal legislation. So yeah, making a lot of change here. Thanks, Claire.
I love it, Kathy. That's great. Great way to kick off our week. You didn't have one, you had many. I appreciate that. In true Kathy from Canada fashion. I'm seeing lots of good ones in the chat. Just a shout out to David from Paws, New York. I love that. We just celebrated training over 5,000 volunteers for our organization. That's incredible. Love to hear that. I'm seeing good messages about partnerships, more about volunteers. Tracy's small volunteer run rescue turns 25 years old this year. Happy birthday to you and your organization, Tracy. This is great. And thanks, Irene just posted the list, posted the link to make sure to enter in the weekly community conversations giveaway. So don't forget to enter each time you join. And again, I know we've got a pretty packed call. We have more people joining, but Shannon, if you wanted to start national updates.
Yeah, if anyone has any national updates, you're welcome to share them via chat or take yourself off mute. We're going to ask that you limit them to about 30 seconds today, so we have time to get through all of our panelists.
It's Kathy from Canada again. So just quickly, our super early bird rate for the summit for animals coming up in Halifax in May has ensured that we have a huge number of first-time attendees already registered. So looking forward to seeing many of you, I hope, in Halifax in May.
Thank you, Kathy. Any other updates folks would like to share with unmuting? All right, we have a quiet group today.
I just have an update. I'm Suliana from Casa Zulis, Animal Society. I just started my nonprofit, and I can notice that we were a nonprofit on October 27th, and we decided to have a goal of sterilizing 100 dogs before the year ended. That was very ambitious because we had no funding. And we were able by December 16th to sterilize 100 dogs and 9 cats. And so that was a big accomplishment, and those are some news.
Thank you. Congratulations, Suliana. All right. Well, I'm very excited to introduce today's programming, Shaping the Future of Veterinary Care, Cultivating Diversity, Trust, and One Health with VetREDI. And we have Dr. Azalia Boyd, Chief Veterinary Medical Officer, Urban CAC Program and Chairperson and Care Veterinary Advisory Committee, and Dr. Raye Taylor, Senior Veterinary Medical Officer for Rural Community Animal Care. Thank you, ladies. I'll pass it over to you.
All right, we are going to share our screen here. All right, perfect. Can you guys hear me? Thumbs up. We're good to go.
Yes, we can.
Awesome. Sounds good. Okay, well, good afternoon, everyone. Good afternoon. We are super honored to be here with you guys today. Like I was introduced, my name is Dr. Azalia Boyd. I am a veterinarian based in the vibrant city of Atlanta, Georgia. And today, myself and my coworker, Dr. Taylor, we're going to talk about, present our Curiosity Saves the Vets presentation, okay? Where we're gonna get into some of the critical issues surrounding barriers to access to veterinary care and how curiosity can be powerful in making a positive change for the industry. So just so that you guys know, I know it's kind of like that after lunch hour, okay? This is gonna be an interactive presentation. So please get ready to be involved with us today. Have your phones out, have your gadgets out. We're gonna do some virtual interactions with you. We do have some fun games and some giveaways at the end so that no one falls asleep. So stay with us this afternoon. A little bit more about myself before I turn it over to Dr. Raye. I graduated from Tuskegee University's School of Veterinary Medicine in 2008, and I'm a proud alumni of the only historically Black college and university with a veterinary school. Throughout my career, I've worn various hats, roles in leadership, serving as an associate in GP and emergency, but today I am the Chief Veterinary Medical Officer for our Community Animal Care Division for Care. And really in this role, I get to dive into my passion of veterinary medicine, centered not just around healing the pets, but also understanding the impact that pets have on the entire family. So today, with Curiosity Save the Vets, remember, it's more than just a presentation. It's going to be lots of fun, but it's also going to be a call to action, because we believe that curiosity, which is that desire to learn more, is the key to breaking down barriers and creating just a better future for all. So thank you for joining us, and I'm going to turn it over to Dr. Raye.
Thank you. Really happy to be here with you guys today. I'm Dr. Raye Taylor. I'm Dr. Boyd's counterpart for the rural section of that, because we know that there's a difference between urban needs and rural needs, even though there's a lot of overlap. My path to veterinary medicine has been long and fabulous. So I've worked with everything from honeybees to elephants. I've studied in many countries around the world, but did most of my training in ecology, zoology, and microbiology at Iowa State, and completed my veterinary school at St. George's University and clinical training at the University of Minnesota at Cornell. So I love being a mixed animal everything veterinarian. It keeps things interesting and busy. So very honored to be a part of the care team. As Dr. Boyd mentioned, we are definitely going to have some engagement here. So if you guys can get your devices out, cell phones, tablets, phones, even if you are on a desktop or a laptop, you can open this window and another window next to this. You can either scan the QR code or you can go to this website, menti.com, and enter this code. If you lose track of this throughout the presentation, it will still pop up. So if you've got changing devices, those types of things happen, don't worry. If you don't get it now, you'll still be able to engage at any point in time just by using that link at the very top as a guide. So just orienting ourselves to it, I see a lot of people are figuring out the heart button. That's wonderful, thank you. So each question is going to be engaging. It's going to pop up on your screen, whatever your device is. If we're not on a slide that's interactive, it won't give you an option. It'll say just to hang out and wait. Or if we advance past the one you're on, it'll say, would you like to advance with us? So just knowing that that is going to be really instructive. You can send us little hearts and comments as we go through. So let's do a practice round. We had an introduction, but I just want to take a poll. Where are you guys at? What do you know about care, the work that we do, or who we're made of? You can select as many options as you like. And if nothing or not much is what you know about care, great, let us know. So that's just a thing. As you enter that, you're going to notice that this will live feed based on your guys' responses. So this is a live update. This is what you guys are saying. We want to hear those voices. And it doesn't surprise us that some people don't know anything about us. That's okay. We're relatively young. We've only been around the block for a few years, 3 years. And so it's a very exciting journey and really proud to be supported by a wonderful group like Maddie's. Just an amazing group of humans out there to help all the other humans that are amazing. So wonderful to be a part of this group and be on today's call. So love that you guys are kind of a really great mix of what do we know about care and that what they like. So I'm really happy to see that our highest score here is wants to help keep pets with people. That's amazing. So much appreciated that. We're going to do one more practice slide here. And that is a little bit of a different activity, same interface, just a different activity. This is going to create a word cloud of what your responses are. And if you send some responses in, you'll have a chance to send some more in. What is the best part about pets? If you guys can keep that to one words, as you guys answer this question, if someone else uses the same word, that word is going to get bigger and bigger on the screen. And it tells us who's got the loudest voice, who's sending the most information, and that looks like so far love is winning, which is not a surprise, I think, to anyone on this call, because there's so many wonderful things about being with pets. And it's very difficult to name just one, because truthfully, it's a constellation of so many, many things. That's one of the things at CARE that we're trying to harness the knowledge about. How do we keep even these named and unnamed things, the drivers to keep animals with their pets? Because it isn't one thing, it's many, many things. And that creates a really wonderful, well-rounded concept called well-being. It's well-being for the animal, well-being for the human, the family, the community, and that becomes part of the greater community, our country. So that's a massive importance of why our animals have such a huge impact onto us. And that goes way beyond the individual. You guys are doing great. I'm loving this map. So love, companionship, comfort, those are the biggest things. And looks like we're all on the same page there. So we're going to switch now to another activity. So I'll give you a second to get your last votes in. And the next question is, in the USA, because that's what we have great data point for. So we're not excluding our outer USA compatriots. We love you too, but we're just going to pick one data point. So in the US, about how many million dogs, I already gave you a clue, we're in the millions, are in homes. So this does not account for the unhoused dogs. So these are dogs that are in, stray populations or maybe at various points in the sheltering system or rescue system. These are homes. How many millions of dogs associated with actual families already? Lots of different, so it looks like we have some high peaks here in the middle. You're really good. All right. So million dogs in the US estimates at about 90 million. 90 million. I saw some wows on the cameras. Yeah, that's a lot. Not to mention who isn't a housed dog. 90 million. So let's take it another step and let's look at our cats. How many million cats are in homes? But I'll give you a hint, it's not 90. The best part is that at some point in time in this, that the wave looks like a cat head because they have wonderful pointy ears. So definitely thinking about this, one fun fact I will tell you while we're waiting for your numbers is that in dog homes, about 2/3 of them have multiple dogs. That means 1/3 of those 90 million, so about 30 million, are single dog households. The other 2/3 are multiple dogs. So here it looks like we're doing really good. We've got about 60. It's actually 62 million housed cats. They're a little bit different in the fact that about half of those cats are multiple cat households. So that says a lot to the difference in the sociability and perhaps to the care that's needed for a particular cat. You guys are doing great. So the reason why I really want to look at this, if we're looking at our dog numbers, just under 1 out of 10 dogs do not get veterinary care. These are families that have a dog. This is not an unhoused dog. These are already the ones that have a human, and still 1 out of 10 are not getting veterinary care. That's a lot, 10 million dogs. So that tells us that dogs are being underserved. However, at the same time, cats, even more underserved. So not quite 1 out of 5 do not get veterinary care. It's over 12 million cats. So here we have an easy stat of 22 million dogs and cats that are not getting care. So what is that? Why is that? What are the things that you guys are seeing? So here's another interactive one. Go ahead and tell me, just like that first word cloud, in 1 to 2 words, what are the barriers that you, as an individual, or you as an organization, or you as hearing from others, what are those barriers to getting care? That's, 22 million examples of people not getting veterinary care. What do you think those barriers are? So seeing cost and money getting pretty big. Transportation, huge call out for transportation. Looks like we've got some wonderful responses here. So looking at this tells me, and it is absolutely what I expected, that this community, this Maddie's community, is really in touch, right? They know, what these barriers are. And unfortunately, many of us know the same things. This cost, this transportation, the availability, the access to veterinary care are some of those huge barriers. So the AVMA, the American Veterinary Medicine Association, also did this study and wanted to find out what people said that their barriers to care were. And I'll let this populate just for a mo, and then we'll come out. Okay. All right, so we have these reasons here. So pets not sick or injured, didn't need vaccines, they gave the vaccines themselves. These are the top ones. And of course, the Veterinary Association says, oh, we're going to focus on the top right. We're going to focus on that 87% because that's a huge chunk. And then we look here at these bottom numbers, don't have money, cost more than it's worth, options in my area are inconvenient, no vets, negative experience with a veterinarian, or too difficult to transport. So for us, we're going to focus here. We're actually going to focus in these areas that maybe aren't the glorious, pretty looking ones that a veterinary profession might want to address. Instead, we're going to look at the ones that are accessible to us creating a solution. So this difficult to transport animals, transportation, that gives us one thing we can pick and work on. We can't fix that if someone had a negative experience to a prior visit, but we can address is creating better tools to avoid some of those negative experiences, because we know that even though it says 3% on the bottom, that those ripple effect into our communities to potentially not necessarily be the primary person having that negative experience, but instead my cousin did this, or my neighbor did this. So having that negativity really can perpetuate beyond the person that's the actual one experiencing it. We're obviously having these veterinary deserts, these resource deserts, as I saw in the graph. You guys did a great job of calling that out. So trying to create creative solutions. And this veterinary costs more than it's worth. That's a communication problem, right? That's the profession not translating the benefit of the cost for certain things to that community. A separate barrier is whether or not they have the money to do that. But this misconception, that's our fault, right? That's the profession's fault because we haven't done a good job of translating that. So you guys did a great job. You're completely on target with what barriers are. So let's dive into that a little bit more and talk about some other pieces of access to care that we'd like to explore. Dr. Boyd?
Yeah, thank you so much, Raye. And yes, the Maddie's community is right on target and in sync. So if we look at this photo, right, I absolutely love this photo because this is the beginning. This is kind of where it all starts, right? We see this beautiful family. We are looking at the young lady's face. She's beaming with joy. They just got this new baby and they're committed to providing the best possible care that they can, right? But those hurdles, those barriers, it's essential for us to know and acknowledge that they're hurdles that many families face when it comes to providing care. So on the previous graph, we observed the factors from studies such as absence to veterinary care, certain areas, not having vets, negative past experiences. And I was looking through the chat, you know, people said fear of shame and judgment, financial constraints, that's usually the biggest one, right? Those are real. These challenges are real, and they affect the ability of families, particularly those from marginalized communities, to really provide optimal health care for their pets. So this is the beginning. We can go to the next slide. And so then that question that Dr. Raye said, what is access to care, right? And we do have this long working definition, and if you try to Google it, there's going to be plenty of definitions out there, but really to keep it simple, it's the ability of pet families to obtain timely and affordable veterinary services. And the barriers, what are the barriers? Let's advance. We saw from the AVMA, right, based on that previous graph, what those barriers were, but we have another source. So this one is the Access to Veterinary Care Coalition. The biggest barrier to veterinary care is financial, followed by the lack of transportation. Then you have that fear of judgment. Imagine that, just someone being afraid of going to the vet because they don't want to be judged, right? And then they resort to home remedies. That's disheartening. Unable to find a clinic with the same language, didn't know where to go. And I did see it in the chat, someone mentioned it, sometimes not having a leash or a carrier to get to the vet, right? So those are some of the top ones. And when we look at those barriers, some may say, well, okay, if you don't have any money, unfortunately, in the veterinary profession, the saying goes, if you don't have any money, you probably shouldn't have a pet, right? And that is, again, disheartening, heart-wrenching, because that is a closed statement, and you just close the opportunity making that statement either out loud with the staff or in your head. You're no longer engaging that client that's coming in and asking for help because you don't think they should have a pet, right? But some people ask, well, what is this fear of judgment? Or why don't you have any money? Or what are your circumstances? And really, instead of saying, you don't have any money, you shouldn't have a pet, we really want to engage people to asking those questions, because when you're asking those questions, that's when you get truly curious, hence the curious saves the vets, about the how and the why, and you really start opening up the opportunity for learning. So when we talk about the barriers, right, we can't overlook that there is broad social inequities that shape these challenges. So we have things like racism and color blindness. These result in an unequal distribution of resources and opportunities that influence access to care for different racial and ethnic groups. We have classism and the myth of being a classless society, right? Some people are like, oh, we don't live in a classless, there's no classism. There is, right? And in that contributes to varying levels of disparities. And then we have the prioritization of money and wealth, where financial status often determines what you're able to access, what you're able to afford, and that creates a barrier for many seeking care. So these are few, right? But these inequities that we're seeing here, it's important to know that these inequities are deeply rooted, and recognize that these are socio-historical, which means that they're constructed over time and are shaped by the history and cultural context. Slide, please. So we have our social inequities, but then we also have social determinants of health. And some of you may be familiar with what SDOH stands for, social determinants of health. But basically what it is it's the social factors that are determining and affecting your health as an individual. And these are very simple things. They're not complex things. So determinants are factors like where you're born can affect your health as an individual. Where you grow up can affect your health. Where you live, where you work, your age, right? They significantly influence health outcomes. And some may ask, okay, well, that's me as an individual. How does that relate to the pets? And there's a lot more studies coming out about social determinants of health for veterinary healthcare. But the likelihood is if you have poor health based on your social factors, that also means that your pet will likely have poor health based on your social factors, right? Again, there's a lot more research being done about that. And we can see that research links poor social determinants of health to ailments like diabetes and heart disease. So we think about all that, we could advance, to the next slide. So we think about the structural inequities and we're thinking adding the social determinants of health, right? And then you have a family who comes from a marginalized community and has poor social determinants of health. They are more likely to have fear of medical facilities, right? Think about it. They don't know how much the bill is going to be when they get there, and they're worried about that. There's a fear in that, right? They don't know what the new diagnosis is going to be for themselves as individuals, and they're worried about that. They're thinking, am I going to be able to afford it? So there's a lot of worry and there's a lot of fear. And then we have to add the historic fear in some cultures of medical facilities. So in the African American community, a lot of African Americans are aware of what happened at the Tuskegee, the syphilis experiment, if you guys are familiar about that, where individuals should have been getting treatment, but they were really being experimented on. And the African American community in particular really holds on to that, right? So in general, that historic fear also makes medical facilities, including veterinary medical facilities, just not being trusted. And when people are afraid to go to the medical doctors for themselves, they also hesitate sometimes in seeking veterinary care. So we're talking about all these barriers, and I'm sure you guys are getting overwhelmed at this point, but guess what? That's okay. Being overwhelmed is a natural emotion because this information is very heavy. So adding another layer to this, right? When individuals do go and seek veterinary care or do for their themselves as a human, but more specific in the veterinary industry, what happens? They don't see people in the industry that look like them, which creates another barrier because they feel like they can't relate to them. And that additional barrier just brings up another layer of the lack of trust. So just really quickly here, 2% of veterinarians, or less than 2% of veterinarians are Black, and less than 0.2% of veterinarians are Indigenous. In animal welfare, we have it being led by 84% of white females, right? So there is, in this industry of veterinary medicine and animal welfare, there is a lack of representation that also exists in the field. We can advance to the next slide. I think it's going to jump into what our clients are saying. And so I won't spend too much time on this slide, but we can see what our clients are saying, right? Let's take a look at maybe just that first comment, which it says, so I have to translate for my parents. At the vet, I remember them looking at us as if something was wrong with us for not getting our pet vaccinated. We had limited funds, but no one asked why. They treated us like we were careless and like we didn't deserve kind treatment. And those are just a few of the comments that we hear on this side of the profession, which is very disheartening, which even gives more reason for why the industry as a whole needs representation. So how do we improve access to care is the golden question. And I love that you guys are still asking questions because that means that you are still here and you are still being curious. So we have some solutions. There are some, and I heard some of this, and I've seen some of the comments. You guys are providing solutions, right? So kudos to you guys for helping fill in those gaps, but there's still a need for low cost and accessible resources for people and their pets. The industry as a whole really needs to incorporate animal health equity into our industry. So that means social workers, animal welfare organizations, veterinarians, insurance companies. Essentially, we all have to work together in order to achieve that. And then we need trusted facilities. facilities that are welcoming, that have inclusive environments, diverse, culturally competent teams. So not just diverse teams, but culturally competent teams, especially in those white-dominated spaces, because we know that the world is wildly diverse and growing in its diversity, and so those factors become critically important. Slide, please. And so some of that work is happening. CARE is also noticing, as an organization, how we choose to improve access to care. As an organization, we're working on addressing biases within the animal welfare and veterinary medicine teams. We're aware and bringing diverse voices to animal well-being, while also advocating for more inclusive paths to pet adoptions, as well as getting into veterinary medicine on the academic side. We're using evidence-based tools and narratives and insights to inspire organizations to be more inclusive, and then also identifying sustainable solutions within communities to create transformative change. Advance. So in 2020, in doing all of that, one of the things that CARE launched in 2020 was we offered a racial equity, diversity, and inclusion course where participants really get to understand the entire ecosystem of life-saving and animal well-being. So we're giving knowledge on social inequities, knowledge on structural inequities, classism, racism, so that people in the industry are better prepared to counteract inequities. Sometimes if we don't know how to do better, we won't do better, right? And so once you have that information, you're really able to identify what's missing in your organization or within yourselves, so that you can better partner with marginalized communities and also reduce biases in the field. And so because we know that that is so powerful on the animal welfare side, we elected to make a very similar course and dedicate the course to veterinarians and veterinary paraprofessionals on the veterinary side. And so that is where we would like to introduce to you all our VetREDI course. Dr. Raye.
So very exciting to take this training that has been really successful and really hone in on the veterinary field. Our veterinarians, technicians, assistants, kennel workers, product designers, pharmaceuticals, students, instructors, because this needs a little bit more TLC, right? This access to care needs a pointed, goal-oriented, available lesson to help bring those professionals up a notch. This is our answer to that. When we look at who makes up our profession, we are going to own the fact that it is predominantly white and female. And there's nothing wrong with that, right? These are amazing humans doing amazing work. And with that, if they're only familiar with what they know, what they've grown up with, then that's the only funnel that they can really serve the best. So by creating a veterinary REDI course, we're going to take those really wonderful, good meaning, intelligent people, and we're going to say, we're going to up your game, right? We're going to give you some tools while the profession really embraces the correction of racial equity, which will take time. We're going to give you tools to be able to connect with the people and do your work to the best of your ability. So with that training, it's going to be very exciting. It's got a lot of pieces to that. This is going to be very much an awareness. We're not necessarily expecting everyone to have an awareness. We're going to start there. We're going to start at the base of the mountain. What does awareness look like? How do you recognize it? How do you recognize privilege, even within yourselves? And how do you just recognize the fact that we're all human? And we all have a very valid, very critical and important role to play. And that is the base of the mountain. You can't know, if you don't know, you can't do, right? If you can't do any better, that's the barrier. So we're going to start with knowing. We're going to learn to combat bias and discrimination that are happening often in our workplaces or who we work with, because that awareness is going to key us in on those things that are maybe already happening and be able to empower those people in that area to stop, to break that cycle. Throughout that does require a lot of changes in your communication skills and how to interact with people. And like Dr. Boyd talked about, that enhancement of the community cultural competence is absolutely critical to success. If you can't understand or appreciate other views outside of your education, which, by the way, is really taught in a very strict, modern, Western medicine. This is the only right way. And so it initially builds you as a professional into a box that's already at a disadvantage. So our goal with this is to open that box and let you see alternative pathways and learn to partner with pet families to be able to include not only people on your team that look like community, but also to include alternative ways or methods to be able to address care outside of those traditional pathways that may or may not be attainable through any number of reasons, whether it's geographical, financial, time. All of those resources are things that we don't necessarily teach in our profession how to address from the get-go. This is hopefully going to be some resilience training as well for those people who are involved. They're going to be the ones that can champion those workplace challenges, be the ones that actually are the drivers of this new culture to be able to be inclusive and help more pets and people. That's going to have a positive impact on themselves, their work-life balance, their ultimately feeling fulfilled by being able to actually establish a connection with families and help more pets live healthier lives. So this improvement of their knowledge and advocacy, as well as a platform for continuous learning, because we all know this is not a one and done type of thing. This is a lifelong journey, and it does involve support. And that's what we're going to be there for, is to provide that support to continue down this journey. We're very much looking forward to engaging people in any role in the profession, to be able to engage them where they are and then help lift each other up. By increasing that knowledge base, that awareness base is the first step in moving towards a positive direction to positively impact change.
And the beauty in all of this is that you guys are not doing it alone. We're not doing it alone. In order to get to that goal, that place that we all want to be for pet lovers and for the pets, we have to do it together, right? So we have to call on community leaders, okay? Because we believe that there's genius within communities. And that's where community members go to when they have questions or concerns about their pets. They may not always go to the vet, right? We talked about those reasons why, but if we can partner with community leaders, that's going to be beautiful. Community trust, lean on the community wisdom. We need the shelter organizations and the rescue organizations. We need allies, we need sponsors, we need teachers and professors and students. We're all doing this together. And so VetREDI is not just a solution. It's a small part, right? But really it's a commitment to the well-being of our pets and the people who care for them, where every pet's health is ready. I hope you get the play on words here. The vets are ready, right? And the pet owners have a peace of mind and they are ready as well, and they're at ease. And essentially, in a perfect world, the world is ready. Dr. Taylor, you're on mute, my friend.
We can't thank you guys enough for letting us speak with you today. At this point in time, just a call out to our sponsors that are helping do all of this amazing work with us and enabling these skilled hands. We do want to make sure before we get too far along, we want to know if you need anything from us. This is part of the interaction tool that we've been using today. If you would like to share your email and any comments or questions, that'll go directly to us. But most importantly, if you share your email with us, we're going to send you some information about the VetREDI launch, as well as enter you into a drawing. So we will be able to connect with you later. We're going to do a drawing this afternoon from anyone who's submitted their email with this. And we were very excited to hear any of your feedback, any of your comments for us as we go through this today. We do have time here that we've built in perfectly here, doing good there, that we'd like the opportunity to answer any of your questions that you guys have that we can answer right now. So I don't know if there's anything.
I have a question.
Yeah.
My name is Juliana from Casa Zulis Animal Society. My organization is in Guatemala. Are there any vets that are willing to travel to another country to provide sterilization services?
So a great question. So looking for veterinarians that are interested in traveling. There are several networks that do that. I don't know of one best source, but there are like Vets Without Borders. There are some groups that go to Central America. So they would be the first ones to be my contact point because they have that established program of, are they legally allowed to do those things in the country? What relationships can they facilitate with you? But that is a wonderful question, Zuliana. So hopefully we can get you in touch with the right people.
Thank you so much.
I have a question from April.
Yes, hi. So I work over in a little Balkan country, my organization, doing spay neuter, and our big sticking point with sort of being ready is that there aren't such visibly diverse people or cultures, but the Roma population, or as people call them, the gypsies, are the outcasts, the outsiders, the ones that one of our British trustees actually said to me, we don't want to waste our hard-earned funds on their animals because they don't care, they're cruel, blah, blah, blah. And I just wondered, do you guys know any people who are doing this sort of inclusive work within Europe?
Oh, that is a wonderful question, April. And unfortunately, that is not an isolated incident.
No, I know.
I know. So actually, part of our REDI training that we've been working through is actually working on European is the next step, our European models, because we have definitely been in contact with some groups in Europe that are experiencing the same thing. Maybe the numbers are different, right? The type of discrimination is different, but it's still there. It's a cultural discrimination that is real and that is ubiquitous. A lot of the core of VetREDI's training speaks to that cultural competence, regardless of what that culture is. And so I think that as we've experienced so much in the last 5 to 10 years of massive exoduses of populations out of their home country into others, is creating that acute awareness of that. I'll see if Dr. Boyd has anything to add, but before I hand it over to you, there are quiz questions that are populating behind. So if you have a chance to click in to that, you can do that at any point in time. Dr. Boyd?
Yeah, just to add to that, I mean, I'm sorry I didn't catch your name, but that question and hearing that story, again, very disheartening. But what I would do is I would challenge the leaders in that organization, in your organization, to take a look at who is in the organization. A lot of times people are afraid of things that they just don't know, right? They're afraid of, not being just not something that they don't know. So if we don't know about the gypsy culture, right, for an example, it might be someone within the gypsy culture that can join your team so that we start having that cross-cultural training without necessarily waiting on VetREDI in Europe, right? Again, like Dr. Raye said, we're working on that, but there's different ways to learn, and starting with getting people within that organization to help increase that diversity is going to be key. And so you said that there's not a lot of diversity, but there's at least a section of people that you guys have questions about or are curious about, because hearing they don't love their dogs, or, I'm sure that there are a lot of just things that need to be lots of myth busting that needs to happen.
Right.
But really adding those individuals onto your team, and even just if they're coming into your facility, spending time with those clients in particular and seeing what you can learn from them. And it's also important to know that not every culture or one group of people are the exact same. So there are subcultures within cultures. So just generalizing or stereotyping this one group, there's a lot I'm sure that you guys can learn about the subcultures within that culture. So I would challenge your organization to start there.
Thank you. If you can sign me up to volunteer with whatever you're working on in Europe, I would gladly do that. I see the problem within our organization is not from those of us based in America, but those based in Great Britain and in Montenegro where we work, and how to even get them to open up to new things is, a challenge.
Absolutely.
Anyway, thank you.
Yeah, if you will send us your email, we want to make sure we capture that info.
Will do.
All right.
Okay. Thanks.
Yep, and we will put that screen up again later, but if not, feel free to enter your email in this chat and we'll save the chat. There is a term question on the chat about whether or not what you can refer to a group of dogs is, and I totally cheated and they're all correct. I've never heard of a mutt of dogs, but I like it. I think it's a great question. What other questions do you?
Oh, I just to chime in, I saw a couple questions that were related. It looks like this is two different people asking this question, but what is the response from the vet community? And then the second part came from Emily. How can we encourage the vets in our community to offer a spectrum of care? Don't know if you want to speak to those.
Yeah. So right now we are piloting our program. We're set to pilot the program. And so we've just been doing a lot of marketing and a lot of conversations around VetREDI. And so I'd like to think, Dr. Raye might have to say something different, but I'd like to think that the professional veterinary industry, they're welcoming to it, right? We are going to have certain groups of people who just don't want to hear about being ready. They don't, unfortunately, want to hear the term equity, or they don't want to hear diversity, or they're saying there's, DEI fatigue. But what's unique about our certification is that we start with racial equity. We're giving information to those who want it. So we don't want to force it down anyone's throat. We're looking at really making sure that we are focused on students as the next generation of veterinarians coming out into the world. That those are, everyone says the youth is the future. And so that's really where we want to focus our efforts. And then I didn't catch the second question.
Oh, it was, let me pull it up. How can we encourage the vets in our community to offer a spectrum of care?
Raye, do you want to answer that one?
I think that's a part of the challenge that we're always facing. I think I left them a note in the chat, but it is a constant battle. So we're in this early stages of being the agents of change. And one of the things that our profession at our American leadership level has not done is really have a concise opinion. And so that is one of those points that makes it a lot easier for us to mitigate changes when we have that governing organization make that type of announcement. So I want you to know that there are a lot of advocates working towards that. We're not there yet. But what you can do from where you are, support those who are doing that work, and you can continue to use those words, using the words of spectrum of care or incremental care, and asking the veterinarians that you do work with or the teams, so like, what training have you had on spectrum of care? Offer if there's any articles that you can share with them about spectrum of care or the incremental care, anything that increases the ability to access. That's what you can do, I think, on the ground level, and know that there's support coming from the other end, but we have to accept that these are going to be slow changes. And if there are veterinarians within your community or nearer to your community that do embrace those principles, to work with them. There we go. Thanks for that.
Yeah, Taylor, thank you.
And all of these are also the correct name for different groups of cats. You guys have been great audience today. Wonderful questions. I see a lot of people putting their emails and information in the chat. So I really appreciate that. Of course, and you have questions you think of in a couple of days, let us know. We'll be on the forum to be able to chat with you. If you've got that question, I'm sure someone else has that question. So feel free to share that with the community.
Oh, Raye and Azalia, there was a statement from Julie Smith. Are you connected to the AVMA? I'm on a committee there and could serve to introduce.
Wonderful. Thank you, Julie. We are loosely affiliated in different ways. So I work with the American Association of Veterinary State Boards and work with some of the leadership groups, but I am not in any official capacity with AVMA. So any introductions that you have, we would be very happy to work with, because the more voices at that table that represent the needs of this group, we would be happy to be that liaison.
Correct. And I'm a member of the AVMA like Dr. Raye, but any connections you have, absolutely, please give us that. Connect us. Thank you.
Wonderful. Well, we just, that was perfect timing. You all timed it great. So we're just at the 50-minute mark, and wanted to thank everyone for being here, and a huge thank you to Shannon, the co-host, and of course our wonderful speakers, Dr. Taylor, Dr. Boyd, and also thank you, Dr. Luna, for attending, and all of the care team that I see you all on here. So thank you all so much, and I look forward to taking this to the Maddie's Pet Forum to continue the conversation. And thanks again for such an engaging presentation. Appreciate you all. Have a wonderful week, and we'll see you next Monday.
Thank you, guys.
Bye.
Thank you so much.